And welcome to the Dr. Bob Show. 3.8 million people in the United States have an irregular heart rhythm called atrial fibrillation. Sometimes we just call it AFib, but it's the most common chronic irregular rhythm disturbance in the United States. And so after age 60, it's not uncommon that somebody says, oh, I've had AFib or I have AFib. So what are the symptoms? How's the diagnosis made? What is the treatment? We may start with medicines at first, and if those don't fail, we may end up having cardiac catheter ablation. And that's what we're going to be talking about on this show, cardiac catheter ablation. My guest is Dr. Nilam Patel. Dr. Patel is a board-certified cardiologist, and he spends most of his cardiology time doing cardiac catheter ablation. He'll be teaching us what that is, how dangerous it is, how safe it is, what the results are. And so a lot of information that you and I will both want to learn about. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we're going to be talking about the dangers of cell phone and social media and cancer of the lungs. What are the symptoms? How do you know if you've got it? And should you be that afraid of it? We used to say that was doom and gloom. Now there's a lot of hope. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Nilam Patel. Dr. Patel is a board-certified cardiologist and spends most of his time doing cardiac catheter ablation. The most common reason is atrial fibrillation. So we're going to be talking about those things and learning about those. And I'm just as excited about learning as you are. Dr. Patel, welcome to the Dr. Bob Show.
Thank you, Dr. Bob. Thanks for inviting me, and it's nice to be here.
Nilam, what is cardiac catheter ablation?
It's a technique where we can use catheter that goes into blood system up to the heart and can treat some electrical abnormality that you can call short circuiting and treat particularly to take care of problem that our patient's having.
So one of those short circuit problems inside the heart, would atrial fibrillation be one of those?
Correct.
So what happens with atrial fibrillation? What's it like when somebody gets it? What are their symptoms? What do they feel like? What's going on?
Most commonly, patients describe that as a fluttering in the heart. Sometimes they also mention they feel fatigued, tired, something unusual that they cannot predict what's going on or understand.
So they don't feel good, their heart's fluttering, scared to death. If my heart would flutter, it would make me scared. So people probably are frightened with that. Do they think they're having anxiety, or they think they're having a heart attack, or they know something's wrong with their heart?
Well, that's very good that you brought up, as a lot of patients do feel that it's their anxiety, panic attack. However, they are having underlying atrial fibrillation.
So what's going on that makes them feel like they could be panicking? What's the heart doing?
Heart is actually fluttering. It's fibrillating, shivering, wobbling, you can say, and makes heart irregular. That's very unusual than their baseline state of health.
So what does the heart rate, if somebody's got atrial fibrillation, how fast can the pulse be?
Pulse can be either very slow if their wiring from upper chamber to lower chamber is not healthy, mostly at a later age, or it can be fast as 180.
Wow, so it can be really, really fast. And if my rate was 150, would I be short of breath?
Most likely.
I would be. And I would have difficulty walking and maybe even wake up in the middle of the night short of breath.
Correct.
And I would feel something in my heart. I would know something was going wrong, I hope, and would say, where's my cardiologist? So how do you diagnose atrial fibrillation?
Nowadays, diagnosis of atrial fibrillation has become much easier than before. I mean, we used to have electrogram that you go to doctor's office and get those squiggly lines.
Yeah, that's the electrocardiogram.
Electrocardiogram printed on a paper. Then we had monitor connected with the cellular tower, so you can attach to your body and detect that either within 24 hours or 30 days. Then we came out with newer devices which can stay under your skin for almost 3-4 years, continuously monitoring.
Whoa, so you place a chip
Sort of, yeah.
under the skin. How long does that say? It's up to 3 years?
Up to 3 to 4 years.
The purpose of that chip is to do what?
It has many purposes, but one of the purposes is that it can help us detect underlying arrhythmia, which has been difficult, that whenever patient feels something, they can't get to doctor's office or emergency room, and nobody can diagnose what that is. So nowadays, that helps us. In addition, also with technology coming in play, Apple Watch and a lot of other devices called cardio, and those are the devices that patient operated, not implanted, also can detect atrial fibrillation. You still need attention from a medical provider, but it still allows early detection.
So there are devices that you can carry with you, a cardio, where you put your fingers on it, it'll do electrocardiogram, we can send that to you, or it will tell them, you have atrial fibrillation.
Correct.
When that happens, immediately they call the doctor and say, I'm back in AFib, or I've got AFib.
It doesn't, most of the time I tell and explain patients that atrial fibrillation is not a life-threatening problem.
Good.
But that understanding does not come on first event. So most of the time patients end up calling physicians or going to the emergency room as they learn the disease process and understand that as long as they are doing okay, they don't have to rush to the emergency room. It comes with time and talking to medical provider.
So what is the treatment, or what are the dangers of atrial fib before you do cardiac catheter ablation?
Most important is stroke risk.
Stroke risk.
Which comes from clotting forming into certain part of the heart.
What part of the heart gets a clot?
Left upper chamber has this rudimentary area called appendage. It's a little outpouching.
Okay, dog's ear.
Yes, correct.
Yeah, and there's a new procedure that you can close off that dog's ear. We'll talk about that later. So there's an area you can get blood clots. That's because the heart is shimmering and the blood is really not moving around, and therefore it can clot.
Absolutely.
So in that left atrium, how does it get to the brain and cause a stroke?
So from the left atrium, there is not much left to get up to the brain, because left atrium, the left upper chamber pumps the blood into left lower chamber, which is our main pumping chamber. And from there, it goes into our main blood vessel called aorta. And from there, all the branches, 2 branches goes up into the each side of the brain and rest in body. It's pretty short distance.
It's almost the path of least resistance is to go up to the brain.
Correct.
So I've heard that 25% of strokes are due to AFib or atrial fib. Is that correct, probably?
Yes, and a lot of could be not detected or not blamed to atrial fibrillation, because we have not been able to associate the timings of it. So it could be more than that.
So we have to find out what the cause is. When we find out the cause, what is the treatment of this shimmering heart with a fast heart rate that's irregular? How do we treat it?
There are many ways we can treat atrial fibrillation. One includes medication just to control the heart rate.
Example of the medication, you can use any medicine you want.
A group of medication called beta blocker, people have heard the names like metoprolol, atenolol, diltiazem.
And so they slow the heart rate down, beta blocker.
Correct. So they slow the heart rate down, but they not necessarily correct the problem. And then the second group of drug comes, which we call rhythm drugs, or more known as antiarrhythmic drug.
Antiarrhythmic. And so what's the name of one of those?
People known, most commonly used probably is Pacerone or Beta Pace. But
Beta Pace.
But the drug names are Sotalol, Immuterone, and those are the drug tried to treat rhythm specifically. So 2 sets of drugs.
And so if those drugs don't work, what's the next step?
Then the next step is what Dr. Bob said, cardiac catheter ablation.
So cardiac catheter ablation. I take it that's the heart, cardiac. The catheter, you do it with a catheter. And the ablation is what you do to get rid of the rhythm problem.
Correct.
Is that easy or difficult?
Well, when you're asking electrophysiology doing it, I will of course say it's easy. However, on patient perspective, none of the invasive procedures are easy to handle. However, technology has made catheter ablation so effective, so safe, and so quick that I would consider it's a great procedure that can provide safety and efficacy.
You already make me feel comfortable if I was going to have cardiac ablation, because technology is helping you to find out how to work that. And that's what we're going to be talking about when we come back. What is and how do you do cardiac catheter ablation? You're going to be so excited, and so am I. You'll want to stay tuned. We're talking with Dr. Nilam Patel, and we're talking about cardiac catheter ablation. We've talked about atrial fibrillation, 3.8 million people where the heart shimmers, the heart rate in the ventricle is sometimes slow, sometimes very, very fast. The biggest problem is throwing a blood clot from the left atrium. But in general, atrial fibrillation is not a life-threatening illness unless it causes heart failure from the heart can't pump enough. But the treatment is fantastic. Now, I forgot to ask one other question, Dr. Patel. Number one, what is another procedure that you use cardiac catheter ablation in addition to atrial fib?
Cardiac catheter ablation can be used in other common condition called supraventricular tachycardia.
Supraventricular, so it's above the ventricle, and it causes fast heart rate.
Correct, absolutely. And that is similar to atrial fibrillation. However, the catheter ablation success rate for that kind of rhythm problem is fantastic. And very rarely it comes back after ablation.
Is that young people or old people?
I tell my patients it can happen in 19-year-old to 90-year-old. So it's a very common problem throughout the population.
So SVT, supraventricular tachycardia, how fast is the heart rate?
Mostly in that one, heart rate is going to be fast, somewhere above 150 to up to 220.
Enough to people where people really know it and they get short of breath. I want to jump into cardiac catheter ablation. What is it? How do you do it?
That mostly done by little IV intravenous access into your groin and passing wires that we consider catheter. We go up to in the right upper chamber of the heart, right atrium. We go across into left upper chamber, left atrium. There are areas that have been known to cause atrial fibrillation, and that's where we attack with this catheter.
So you've learned that there's certain areas that you feel pretty sure when you go in there. How do you know where you are in the heart?
Very interesting question. In past or still, fluoroscopy, how we get x-ray.
Yeah.
That technique helped us in knowing where our catheters are. We have advanced from that nowadays. That technology has provided electromagnetic field-based sensors and a mapping system where we can create three-dimensional imaging of the heart.
Mapping causing three-dimensional picture of the heart. Now, I've heard about mapping. I have no idea what it is, and I didn't know about three-dimensional. So when you're in that, do you look at a television? How do you know the three-dimensional picture?
It is essentially television, when you mention. It's a screen that we can create that image real time as the catheter touches the heart. It's creating this shell. And where we are going to work, it completes that shell, and that we can work in that. So we don't need fluoroscopy.
So how do you know where to do the ablation? And what happens with ablation? What is that doing? Ablation to me means you knock it out.
Absolutely. That's exactly what we are doing. We are knocking out the areas of the heart that is causing the problem. Very minimal area of the heart. However, when we do ablation, we do it two ways. One called heat, which is radiofrequency ablation, and the other one is cold, which is cryo ablation. Essentially, the goal is to kill that particular area of the heart. which is not causing any damage to the function of the heart. It's causing damage to the areas that's causing the problem.
So it's triggering off the electrical shivering of the heart, and you're getting rid of those trigger areas.
Absolutely.
And you can do that with heat or with cold, radio frequency ablation, or cryo. That's the code. Let's talk about the radio frequency, because that was the first one that came, I think, 'cause that's the only one I know about.
That is true.
So tell me about, what is radio frequency ablation? How do you do it when you get in the heart? Is it with that catheter? How do you know where you're ablating?
So it is the catheter. It goes into the left atrium, touches the heart. We are targeting areas around pulmonary veins. They are the blood vessel draining oxygenated blood from lung into the heart. So that's where we are targeting, around those pulmonary veins. That's why, if you have heard sometime it called pulmonary vein isolation.
Yeah.
So that's the word for that.
So the lungs take the oxygen that they get from the blood they get to the pulmonary vein. That's the only vein in the whole body that has oxygen in it, because it's carrying it down to the heart. Correct. And that's where you're looking for.
Correct. Correct.
And do you map certain areas of those pulmonary veins? How do you map it three-dimensional?
So we create globular or oval structure of the left atrium, and there are outpouching of the 4 pulmonary veins. So you can literally put your catheter, pass into the pulmonary vein to create those outpouchings.
And you press a button and it goes bzzzt, or what do you do?
It is, yes, I can say that yes, we do. Person in my lab does press a button to get it going. The way it works is through those catheters,
Yes.
Electricity passes, and that goes into the catheter tip into the heart muscle, and back out of a patch attached to patient's body, back into the generator. This creates the electrical circuit. What happens at the site where catheter tip meets the heart border or the heart tissue, that's where there is a resistance, just like how your bulb lights up. That's where the tissue gets affected.
So you're targeting those areas and you're putting radio frequency. What is it when you go zap? Does it make a little pop? Does it have noise? Is it dangerous? Does that make the heart wiggle wrong?
We do see the effect on our certain parameters that we look at it. However, nowadays the technology is so good that the days of pop and causing other problem is getting lesser and lesser. We can cool the tissue at the same time you are heating.
Oh my goodness, is that a fact?
Yes, and in addition to that, we can tell how much we are pressing inside the heart.
So it will tell you how much pressure you're putting on, how much heat you're giving it. So quickly here, let's talk about the cold ablation. What are you doing with that? The same thing, instead of heat, you're using, how are you making it cold?
It's the same nitrous oxide, the gas that we use that cools down the end of the catheter. However, here, the catheter is slightly different. It's a balloon. It's a little tiny balloon that goes into, if you think that left atrium as a funnel, and the funnel is ending with a pulmonary vein, the balloon gets stuck into that funnel, and then once you freeze, essentially it still creates that circular lesion around the pulmonary vein by freezing, like a frostbite.
So you've got frostbite or radio frequency heat. So you've got two ways. Which do you prefer?
It depends on patient population. They both are studied in certain patient population, and they both are effective. There are some where we wanted to use catheter because it has more freedom to go in different places. In certain patients, it's better to use the cryo balloon ablation, but it depends on patient to patients.
The results that you get from the cardiac ablation with radio frequency heat or the cryo cool, what are the results? Because you all are so good now. As you say, technology makes us gooder.
the results are getting better and better. I should say that about 85% of the patient, and again, this is a number that has been done by research a few years ago. So if you think, I think that number is getting better and better every day with technology being better. 85% of patients stay free of atrial fibrillation at first year.
If they have to come back and have it a second time, what's the percentage that works?
That increases that every time, but then the margin is lesser. But I would say that it can get up to 95%. In some patients, 100%, because they are the one subject by itself. But it depends patient to patient. Average number when you put everyone together.
You know, I know when you do hundreds that somebody is not going to be the one, but I've never seen anybody that had cardiac catheter ablation that didn't say, my atrial fib is gone. As a matter of fact, in 2008, I had cardiac catheter ablation for atrial fibrillation.
Oh, wow.
I've never had it since. So you all are amazing. Now, I'm going to come back on another segment. I'm going to spend a little bit of time talking about what the recovery time is like and what the patient can expect. And they were on a lot of medicines, and now what kind of medicines are they going to be in recovery? Is that a good topic?
Sure.
That's what we're going to be talking about. Sure. What a great teacher Dr. Patel is. So I'm going to come back and we're going to spend a little bit more time. We're talking with Dr. Nilam Patel, and we're talking about cardiac catheter ablation, and we're talking about where you can get a three-dimensional picture of the heart, and we put a catheter with electricity where we can use radiofrequency ablation, that's the heat, or we can put cold frostbite, and that scars where the excitability areas are that are triggering atrial fibrillation. I had no idea. And technology has made it so much easier and so much safer. And there's at least an 85% chance, and to be perfectly frank with you, Dr. Patel was being very polite. It's much better than that, most people. Now, when somebody has an ablation, you just say bye-bye, or what's it like the next day? Are they able to go back to work? What's it like when they recover from ablation?
Very quick. Some patients or some centers would allow them to go home the same day after 6 hours of bed rest. Newer technologies that can close the area where we put IV in even faster. Whoa. Most of the places would keep them overnight.
So you stay overnight. To me, that would mean so the nurse can be sure you're not going back into irregular rhythm.
Correct.
And the next morning, how do they feel when they've had radiofrequency or frostbite inside the heart? Does their chest feel a little sore, or?
Yes, that some patients can feel that. Most of them are very comfortable and would not even feel other than just undergoing general anesthesia. So most of them can go back to work the day after they are discharged.
And how do they feel? Does when they've been in atrial fib and suddenly they're in normal sinus rhythm, how does that make them feel? To me, that's exciting because I think they're going to feel like a new person.
That is so true. A lot of patients are very thankful that it has changed. That day before and after, it's totally different.
When do you stop their medicines? When you send home the next day, they'll usually have some medicine. How long does it take to get off those medicines?
It depends on how stubborn the atrial fibrillation was. Some will require a little longer than others. However, our goal is to get them off as many medication as we can.
So most of the time, every person is an individual, so it's not good to say. But probably in a month you can get rid of one, and 2 months you get rid of the other, or are faster like that.
You are so good. That is true.
So it must be a great feeling for the patient to know that they're in normal rhythm, that they don't have that incidence of having a stroke, that their heart is. How frequently do they go back into atrial fibrillation?
Again, it comes from the stubbornness of atrial fibrillation. However, if they are going to go back, we will find out very quickly, or it may take another year or so, or longer.
Dr. Patel, I can't tell you how great a teacher you are. I have been thrilled to have you as a guest. I mean, I have really learned a lot, and I want to thank you for coming to the Dr. Bob Show.
Well, thank you for inviting me, Dr. Bob. It's been fantastic.
And now I was going to talk about a couple of things. We were going to talk about the symptoms of lung cancer. That could be hidden, it could be quiet, it could be that you have weight loss, you could be coughing up blood, you could have a cough that doesn't go away. With weight loss, think about a persistent cough with weight loss and anemia, seeing your doctor. Think of lung cancer all the time that we have for this show. Remember to be exercising every single day, 15 to 30 minutes. You'll find that that will change your life. It'll make you feel better, lower your blood pressure, reduce stress. It makes you have a runner's high. It actually brings out chemicals in the brain that make you feel better. Eat right, eat foods with fruit and fiber, and get your body healthy. Have 7.5 hours sleep or more. Check with your doctor on how much you need. If you're not sleeping well, check with your doctor. There's nothing like a good night's sleep. You'll feel better. The people around you will feel better if you have that good night's sleep. And remember, laughter in your life. You laugh a lot and you're going to stay healthy, and you're going to stay happy, and you're going to say, hooray, I'm alive and happy.